I'm Papa Penguin, and these are my pontifications on what the VA's Office of Inspector General report said about veterans and disability fraud. We're going to talk about what it actually says versus what people think it says. Roll the tape.
Get into it. Slide number 1. Here's slide number 1. This just basically says U.S. Department of Veterans Affairs, Office of Inspector General, Office of Audits and Evaluations. VBA, Veterans Benefit Administration, without effective controls, public disability benefit questionnaires continue to pose a significant risk of fraud to the VA.
Telling you that fraud is real, and entities, as noted here by the OIG report, not by me, they are doing something. Something is going on.
That there are, in fact, fraudulent claims inside of the VA disability system.
Far, far worse than what he initially was explaining to you guys.
So, what does this report actually say? Well, first off, it says they didn't actually look for any fraud. And second, it says that academic laziness and bureaucratic dysfunction equals a training. What were the problems with this study? Where do I begin? Let's start with the questionnaires they send out for people to fill out. I think they call them DBQs or something like that. So in 2010, I believe, they started allowing civilian providers to fill these out. And when they did that, they created a two-tiered system, meaning the questionnaires that are filled out in the VA and go directly through the VA system, right? VA admin, VA providers, had a much greater level of scrutiny than the ones that came from non-VA providers. So they created a system where it's supposed to be the same standard, but there wasn't. So they started the system off screwed up. Second one, the claims processors, I can't wrap my mind around how this is supposed to work. The claims processors aren't required to authenticate anything on the questionnaires, but they're supposed to consider the authenticity of that information. I do not know how you consider authenticity without authenticating something. These are the vague kind of instructions VA leadership gave to VA employees. And you wonder why things get screwed up. This one's really good. Third item, the IG team discovered there were no mechanisms to monitor for potential fraud in these questionnaires. And the VA has no guidance on how to identify fraud coming from these public questionnaires. Fourth one, the VA didn't provide any sort of training or guidance for the claims processors on how to determine if something was authentic or if it was potential fraud. Of course, in order to conduct training, you would have to have a mechanism in place to detect it. So, yeah. And then we're going to talk about the structural problems with this study. So the IG team looked at 100 claims over a 1-year period from January to December of 2022. These 100 claims had a little over 200 questionnaires attached to them. And what they found was 69% had one or more potential indicators of fraud, 55% had 2 or more indicators, 24% had 3 or more indicators, and they projected that could cost the VA up to $390 million a year. No idea how they came up with the $390 million number. No clue. But the biggest problem is, or the first problem is, the study had a 90% confidence interval. What does that mean? That means that there was a 10% error margin. This is important because typically in these kinds of studies, 95% is the standard for confidence interval, 5% margin of error. And they would have only needed another 200, 250-ish claims to hit that 95% number probably. And considering the VA does well over 1 million claims a year, I'm sure they could have come up with another 250 claims that came from civilian providers. Why didn't they? I don't know. Now we're going to look at the questions they designed, right? These are the potential indicators of fraud. So first was, is there a sign of alteration on the questionnaire? Well, they didn't define what alteration means. Somebody spill coffee on it? Does that count as an alteration? Did someone make a mistake and line things out? What about veterans who have TBI or neurologic conditions? Does that count as an alteration when their handwriting shaky or all over the place? I mean, they've already said the VA doesn't train people, right? It doesn't train the claims processors. So if you just say alteration and then don't define what that term means, how do I know those numbers are accurate? Two, if the claim had questionnaires with contact information discrepancies, well, considering veterans are at risk for homelessness, it would be shocking if there weren't contact information discrepancies over any sample size of um, disability claims. Third, this one's a legitimate question. Is the examiner's address more than 100 miles away from the veteran's address? Yeah, that's a decent question. Four, was there other evidence contradicted in the findings on the questionnaire? Well, what happens if the veteran went and got a second opinion? Right? They went to the VA said, no, you don't have this condition. Veteran said, nope, you're wrong. And he goes out and sees a doctor outside of the VA condition and says, yep, you absolutely do have this condition. Here's the proof you have it. I'm not sure that really is a good question. Five was did the veteran refuse to report to the VA for examination? Aside from the fact of nobody likes to go to the VA, even the people who work there. There's any number of reasons a veteran may not have showed up for the examination that have nothing to do with fraud. Transportation issues, right? If the veteran's vehicle doesn't have access to a vehicle, what happens if they're in an area where there isn't reliable public transportation? What if the veteran has mobility issues? What if the veteran has mental health issues that make going to an appointment in the hospital with people asking him all kinds of intrusive questions presents a challenge, right? So yeah, that's not the best question in the world. Number 6, 100% disability rating, but no evidence of current medical treatment confirming the severity of the condition. Well, did you know, as a veteran, if you seek care outside of the VA system and it's not a VA approved doctor, they don't count that as medical care. So if you have a 100% disability rating, but you're going to see a doctor that can provide you with a treatment modality that's helpful, but they're not a VA approved doctor, the VA doesn't consider that getting treatment, even though you're receiving treatment. And lastly, the most important finding of this whole study on veterans and disability fraud was the Inspector General's team did not determine whether the benefit payments resulting from these determinations were improper. So in other words, they created a whole study to look for fraud and then didn't look for fraud. All this study proved is a poorly designed system with poorly trained employees equals the problem isn't the patient. And lastly, I just want to say, if the VA wants to stop allowing civilian providers to help veterans access their disability benefits, just say so. Don't try to cover it up by concocting some poorly designed study that just proves the VA is nothing more than inept and bureaucratically incompetent. That's all I got to say. If you guys got any comments, please feel free to leave it down in the comments. Hit like, share, subscribe. Thank you very much. Papa Penguin out.